Hi, I'm Kyle Gassett, Director of Troy Public Radio. In the next few days, the U.S. Senate will vote on legislation that would eliminate federal funding for Troy Public Radio and other stations for the next 2 years. This funding helps us bring you news, music, and life-saving weather alerts. If Troy Public Radio is important to you, please visit protectmypublicmedia.org now and secure the future of this station. Thanks.
I'm Kate Nesbitt, and this is The Rounds, a podcast where nursing professionals, community leaders, and nursing faculty share stories and practical advice for current and future nurses of all specialties. I'm joined by nursing student Brooke Mosley.
Hi, everybody.
Today we're talking about wound care. Not the sort of wound you get when your heart is broken or even the kind of minor cut you might get from being careless with a kitchen knife. We're talking about serious wounds that require serious treatment. Brooke, who's making the rounds today?
Today we have Shannon Godsave, who is a wound care and hyperbaric medicine nurse practitioner. He's actually Alabama's first nurse practitioner certified to supervise hyperbaric oxygen therapy. He's going to tell us all about how he evaluates and treats serious wounds.
Did you say hyperbaric as in that spaceship chamber they use for scuba divers?
Yes, I did.
What does that have to do with wound care?
You know, Kate, that's a great question, and I think I know just the person to ask.
Hyperbarics is concentrated oxygen. It's 100% oxygen that you breathe while you're in the chamber. But the difference in breathing that and just oxygen out of a bottle through a mask is the fact that it's pressurized. What it does is when you breathe in 100% oxygen, let's say you're in the hospital and you're having shortness of breath and they put you on a mask and they give you 100% oxygen on a mask. Okay, that increases your blood oxygen level to a certain point. Whenever you go into a hyperbaric chamber, it changes the gas laws with pressure, and it forces that 100% oxygen even more concentrated into the bloodstream because of the pressure. It's one of the gas laws called Henry's Law. It's a pressure-induced 100% oxygen forces more 100% oxygen into the bloodstream, which then ultimately makes it to the tissue or to the distal parts of bone, like the toes or fingers, that do not get a lot of blood feed anyway. Those bones do not get a lot of blood feed. So whenever you increase that oxygen and that pressure, bacteria hate oxygen. Whenever you oxygenize a bacteria, the bacteria cannot thrive. So that oxygen helps kill the bacteria. Well, in conjunction with the hyperbarics, we usually have patients on antibiotics that kill the bacteria that are eating bone or tissue. And those two things in conjunction help stop tissue loss, stop bone death, and ultimately save either toes, feet, legs, hands, whatever is affected by bacteria and the flesh death.
Oh yeah, I mean that is a lot more than I thought was happening.
It's pretty intense as far as using those two things in conjunction. You know, IV antibiotics, we treat infection with it, but whenever you start talking feet that have osteomyelitis or toes and you have bone destruction from a bacteria in there, you just give an IV antibiotics, you're kind of just sprinkling a little bit of sand on top of a big beach. You have to dig in there and get to it to stop the erosion of the bone. And to do that, the high pressure oxygen, as in conjunction with the IV antibiotics, usually does it. And then you save the person's, affected limb or toe or however, whatever is affected.
Is there any way you could give us like an example patient and how that treatment kind of gets applied to their just everyday life? I mean, how does a patient come see you?
It can be self-referral. If they have a wound and they're concerned, especially a diabetic, please check your feet. If you have a wound or an ulcer, make an appointment. It doesn't have to be from another physician's office. It can be a self-referral. Our hospital here in Troy, we go over and see inpatients if the physician consults us to come over and see a wound. And then surrounding communities and physician offices will make referrals for patients to come see us. We're the only wound care center in the southeast area of Alabama that has hyperbaric chambers for wound care.
Speaking of being the only or the first, you were the first nurse practitioner in Alabama to be certified to kind of oversee this treatment. What led you and inspired you to kind of pursue that?
I find it interesting to start with, but it's almost like it found me because when I was growing up, I did a lot of scuba. And, when you scuba dive, you learn different gas laws, especially whenever you start talking any depth of water, you have to decompress whenever you come up, or you get what's called the bends. Well, that's nitrogen buildup in the blood, and you have to get rid of that as you resurface because of the different atmospheric changes. And then there's other laws. You hold your breath underwater, and then you come up, you can rupture a lung. Anyways, all those different gas laws, I really never knew the relevance to many things until I started doing flight nursing years ago. And when I started doing flight nursing and I got certified to be a flight nurse, which was national certification, you started talking about gas laws again. I was like, oh, here's these gas laws. And they're applicable to that because of variance in pressure. But then whenever I got into wound care and started dabbling with the hyperbarics with Dr. Schlamer, I was like, this was interesting on how this helps heal the human body. And then started learning. I did a 40-hour CE class on hyperbarics, and it was the same CE class that the physicians had to take, to get where that they could be certified to monitor the hyperbaric chamber. So I did it, and I was like, well, I want to do that too. And so Dr. Schlamer trained me, and we applied through the State Board of Medical Examiners for him to be able to train me, and they approved the training, and then the Board of Nursing was involved, of course. And then after training and approved monitoring, then they granted me the privilege to monitor hyperbarics.
So you mentioned scuba diving. Is there any difference in your hyperbaric chambers that you use for wound healing compared to a hyperbaric chamber used for a diver who has the bends? Is there any difference?
There's a difference in the fact that these are called monoplace chambers. They're cylindrical chambers where a patient gets on a stretcher and we push them in, and then they're in this chamber with clear plexiglass around them that's like 4 to 5 inches thick. So you can see them totally. They can see out totally. They're watching a television. You can communicate back and forth on a communication radio, phone. The difference then comes into what they use for people that have the bends or nitrogen toxicity. Is they put them in multi-place chambers, meaning you could have 2 or 3 divers go in to this. They kind of just walk in and sit down, and it's almost like a vault, a room, and they stay in there for hours upon hours until they decompress and get the nitrogen buildup out of their blood. But that's the difference, monoplace versus multiplace. Mono meaning one, multi is you can put how many ever the room is designed for to go in there.
So have you had any rewarding experiences while doing this? Anything that's continued to kind of interest you within wound care?
Absolutely. I mean, we see wounds that we end up healing out. I've got one man that went to the hospital and was admitted and to have surgical debridement of his foot because of the wound. And then I was consulted, and I went over and seen his foot. It was the weekend I was consulted, went and seen his foot Monday morning and worked with the surgeon, had to have another debridement, and then we brought him over quickly that early next week and got him into the hyperbaric chamber because he had necrotizing fasciitis of the foot. And so with I don't know how many dives, these 6 weeks of dives later and a lot of surgical debridement, then within the clinic setting, we've about got him healed where he saved his foot. So That happens routinely where we're able to make a difference. But a lot of it is, I'll be honest, is adherence to what we ask to be done, to compliance, patient compliance, because we make recommendations and it's up to patients to follow what we ask, and there are some that just don't, whether one reason or the other, and then there are many that do, and we have a great outcome.
How do you educate your patients on what you're doing and how it affects them? And I know you'll have patients who maybe just straight up don't listen, but how do you sort of go about educating them so that way maybe they listen a little bit better?
It starts off as a, this is what I need you to do, but it turns into a dialogue with question and answer. And the biggest thing with wounds and teaching people on how to care for them is the fact of whenever you have a wound on your lower extremity, just don't get in the bath or the shower. And patients always look at you funny, like, you don't want me to take a bath? No, I don't, because what happens in many of those cases is you're washing bacteria from your upper half of your body down into the water, and the bacteria then end up in your wound.
I was thinking
So
just like the wetness I wouldn't want, but no, I didn't even think about that. I didn't think about the bacteria everywhere.
it's a dialogue. Whenever you teach patients, you start off with, this is what I like you to do, and then you turn it into a dialogue with question and answer. Like I said, 95% of the patients adhere to what we need them to do to help heal, but there are the few that are just non-adherent, but we still treat them and hope for the best. It takes a lot longer to heal a wound typically whenever they're non-adherent.
So obviously, like you said, communication, and it seems like patience are big skills needed to deal with wound care. Are there any other skills that you can think of that are specifically directed towards wound care that could help current nursing students?
I do a lot of sutures, so I guess that's an advanced skill that just nursing students wouldn't do. But I don't think there's any specific skill sets. It's just having an understanding of wounds and having that desire to learn on how to take care of the wounds.
Can you walk us through like a typical day of what a wound care nurse does? Like, what do you do on a day-to-day basis?
Well, I'm actually a provider, so as far as a wound care nurse, it's kind of a separate, if you want to talk a separate job duty. What I do is I perform surgical debridements of wounds. The actual wound care nurse, they're the ones that undress wounds, irrigate the wounds out, stage the wounds, prepare, the room for the provider to come in and do the evaluation and treatment of the patient. They will carry out the orders at the end of the debridements and treatments, and redress the wounds and provide any other liaison towards other entities like home health.
What are some of the different wounds that you kind of deal with?
We have a variety we deal with. Anything, any wound. It can be a laceration flap. It can be a diabetic foot ulcer. It can be arterial or originated ulcers on the leg, venous stasis ulcers, burns of any stage, all the way to full thickness burns. We deal with a lot of those. If you have an abnormality on the skin, it's a wound, we deal with it.
Nice. And as I'm going to ask the question as a person who doesn't know anything, and a laceration flap, is that just like an area where there's skin that is not attached that is still healthy, and ulcers, I'm guessing, are going to be holes in the skin and areas?
Right, a laceration can be, it's a cut in the skin, but we deal with complicated lacerations, typically ones that have large flaps where the tissue is peeled back and then it has to be reattached. And those flaps can become compromised, so we have to keep a close eye on those. And if they get compromised where the flap will start to die because of lack of blood flow, we have the ability to get a patient in the hyperbaric chamber to increase the blood flow to the flap to save the tissue. But it's one of those things, it's not an immediate difference. It's not like you go to the doctor and you have cut yourself with a kitchen knife And so the doctor sews you back shut, and then a week later you healed. It's a little different. Most of the wounds that we put into hyperbarics, we start off with 30 treatments, and sometimes they'll go up to 45, even 60 treatments, which is every day, 5 days a week for that many weeks. And then the wounds are not always healed at the end of the hyperbaric treatments, but we have killed the infection in the bone to save the limb, and then we have to finish healing the wound, which takes a few more weeks after that.
And I know that you began your nursing kind of education at, was it Lurleen B. Wallace?
No, actually, I started nursing in Florida.
In Florida?
I went to a school in Inverness, Florida, which is in Citrus County. I went to a nursing school there and became an LPN, a licensed practical nurse, was my first licensure. And I left Florida and came to Alabama, and it was within a year of becoming an LPN, then I wanted to be an RN, because in Florida, as a LPN, they had a different pay scale, and you were able to do more skills than what you could in Alabama. So whenever I came here, I felt like my hands were tied, and I was very bored. So I went to Lurleen B. Wallace as a bridge, LPN to RN bridge, and did that program. And then I was an RN for years, and then I just wanted to do more. So that's whenever I said, well, I want to become a practitioner. So I had to do the BSN program and then the MSN program.
How was your experience at Troy and doing that MSN program?
I had a great experience, great instructors. I knew many. Being here in the community that we are and in the settings of where I worked, I interacted with a lot of the instructors, interacted with them and their families, was able to help, and everybody looked out, to make sure that I had all the tools that I needed to be successful. It was more than just you're a name and a number. We had relationships, so it was good, a good experience.
What's the difference between a BSN, like getting your BSN, and then also going afterwards and doing your MSN? I know that Brooke's going through checkoffs and a whole bunch of other stuff, and I'm assuming there's a lot more leadership education in that MSN, but what's that difference like?
The bachelor program prepares you for leadership within, like a managerial leadership program. They don't focus near as much on the skill set because you already have the skill set. You've been a registered nurse or whatever.
With the
Unless
bridge,
you're just
yeah.
If you're in the 4-year BSN program, then you've not been a nurse, you're not doing the bridge program. They still focus more on leadership, where I've noticed that the associate degree nurses, their program's more focused on skill set versus leadership. It's just the dynamics of the program. The master's program focuses on leadership and having a knowledge base to be a provider, to be able to work underneath and with a doctor, with a physician as a liaison, as a collaborator, and provide health care to patients.
Is there anything that you wish that students were learning about hyperbaric medicine while they're going through all these different, classes and stuff? Is there anything that they kind of, maybe not people who are necessarily interested, but things that they should learn? Because I know that earlier we've talked about you being asked to consult on stuff, and there's a lot of, multidiscipline and specialties that are kind of working together, especially for wounds. Is there anything that you would want students to kind of know, just education-wise, before they get into the field?
Multidiscipline-wise, we work hand in hand with surgeons, orthopedic surgeons, vascular surgeons, dermatology, family practitioners, or to internal medicine. When you start talking about wounds and the origin of wounds, you have to work with those other specialties to, provide what's needed for that patient to be able to heal. An example being a diabetic foot ulcer. What's a patient's hemoglobin A1C? What's their blood glucose been running? Do they have a family care doctor? Have they been going to the doctor? Do they take their diabetes medicine? Do they have proper offloading in their feet? So you have to start talking about shoe inserts and sending them to those type of people. So when you get into wound care, you have many different people that you have to interact with, different providers, and be able to know when to use them and consult them and bring them in on patient care.
Yeah, so you mentioned going through essentially a nursing curriculum 3 separate times, from your LPN to your BSN and then through your master's program. Do you have any advice for those nursing students who are currently struggling to learn all those medications in pharm, or who just are wore out and ready for it to be over with? Do you have any advice for them?
Stick with it, because in the end you'll reap the rewards of what you have put all your hard work into. Just stick with it. There was many times that I was tired. I was working full time, going to school full time, family full time, and it's tiresome. There's hours where you have to sit and study, read, do clinicals, and you're tired and exhausted, but do it now, stick with it, and you'll reap those rewards.
Is there any last advice you want to kind of give the listeners about wound care, if they're interested in it or if they want to do some more research on it?
Last minute advice is just pay attention in school. There's many things that your books, while you're in your program, will introduce you to, and then whenever you want to get further into it, do the research and read articles on the internet, look at stuff. And then when you get into base practice, start to pay attention to various wounds, whether they be pressure injuries or diabetics with ulcers on their feet. And if you want to get further into it after that, just reach out to different things like a national certification, where you take a program and then earn that certification just like you would your nursing license. You have to go take an exam and, of course, pay money, but take an exam and pass the certification level to become a wound care certified nurse.
Well, thank you so much for joining us today and answering all of our questions and kind of guiding us on what wound care is, especially as a provider, and what students and other nurses can kind of look forward to if they're wanting to go down this path. Thank you so much for joining us.
You're welcome. Thank you for having me.
Well, we've come full circle on this episode of The Rounds. We want to thank our guest, Shannon Godsave, family nurse practitioner. But before we go, don't be afraid to press that call button. Record a voice memo with your question for our guests and send it to kross120311@troy.edu. It can be anything from, how do I get started in nursing, to why does it hurt my elbow when I do this? Quick disclaimer, nothing you hear on The Round should be considered medical advice. If you have a serious medical question, ask your doctor.
You can stay up to date on new episodes of The Rounds by subscribing to the podcast platform of your choice. And be sure to share it with a nurse or nursing student in your life. The Rounds is recorded in the studios of Troy Public Radio and produced by Austin Toy, Kate Nesbitt, and the College of Health Sciences at Troy University.
So, until next time, I'm Kate.
And I'm Brooke.
We'll see you again next month when The Rounds returns.